And so far today we've spoken about the challenges, about ways to meet them with, for example, lay counsellors. And we also talked about the small window of opportunity that we actually have today where we can end the AIDS pandemic. But for that, money is needed, we've also heard. And Pia Engstrand is the lead policy specialist for health at Sida, the Swedish International Development Agency. And I want to ask you the same question as I asked Mr. Hjelmåker earlier. What about Sweden? Is the government prepared to put in more money? And are we willing to maintain the role we've maintained so far? The floor is yours.
Thank you. So let me start by thanking MSF very much for hosting and organizing this seminar. I think presentations have been excellent, and most of us, although many of us have been working on HIV and AIDS for a long time, I think we all have learned something new today, so thank you. As you mentioned, I work for a bilateral agency. We're a funding agency. We are not implementing programs. Instead, we are funding many of you who are here and others as well. So I'll start a little bit about... no, I did something wrong. Is it just... Aha. Down, okay. Okay. So, as I said, I've been working on HIV and AIDS for quite some time, and I remember our old HIV and AIDS policy. I'm starting with this just to be able to show you that Swedish and Sida's priorities when it comes to HIV and AIDS have actually remained more or less the same. For a long time, we have been focusing on prevention of HIV, and also including what was at that time very sensitive, what the sexual and reproductive health and rights issues. You know that sexual rights issues at international level, multilateral level, and in countries is oftentimes very sensitive and difficult to talk about. And this was really the case in the early 2000s and onwards. So here you see what our policy at that time included. And I want to move on from this, looking at one of our key strategies today where HIV is included. We have a new strategy for HIV, for sexual and reproductive health and rights in sub-Saharan Africa. It was adopted this summer. And it's a 5-year strategy focusing on SRHR. This used to be a clear HIV and AIDS strategy, but has now then become more of an SRHR strategy. I think this was mentioned previously. Are we now taking AIDS out of isolation? Are we talking about health broader, as Lennart mentioned, or are we talking still only HIV? And I think this is an example of how our current government wants to keep priority on the broader issues, sexual and reproductive health and rights, and to see HIV as one of the priorities within that field. So this is a strategy that has a large funding envelope. The Swedish government puts in 350 million Swedish crowns to work on SRHR and HIV at the regional level in Africa. Apart from that, we have HIV funding also coming from other levels that we say at Sida, the global level. Lotta Roos, who is here, she's handling a portfolio including HIV/AIDS Alliance, IPPF and others at the global level. And then, of course, we have some funding for HIV at the country level, and we say bilateral level. And in most of these portfolios, the focus is clearly on HIV prevention, on comprehensive sexuality education, on human rights for LGBT people. That is fundamental to address HIV and AIDS, of course. But also, as you see, broader prevention of gender-based violence and health systems strengthening. Lennart mentioned that Sweden, and then it's the Ministry for Foreign Affairs, puts in 850 million Swedish crowns to the Global Fund this year. I think all in all, the Ministry for Foreign Affairs and Sida has a total funding of 1.2 billion Swedish crowns for HIV and AIDS this year. And Sida then has about 400 million Swedish crowns of that. The team in Lusaka, our regional SRHR team, has a portfolio comprised of different partners, and one could, if one tries to, say a little bit about what these partners do. Some of them work at service delivery, but not so much. You will see that the biggest chunk is really aiming at capacity building at the national level, at community level, and also regional level, meaning perhaps African Union, SADC, and other key institutions and organizations. Another important area in Sida's funding is to advocacy, and that of course aims to support partners who work towards the government on accountability, to improve legislation, etc., which we think is very important. And then some to research and some to more normative work like UN organizations. This is the partners at the regional level, and I wanted to show you this so that you can see that more than nearly half of the funding from our regional team, 350 million Swedish crowns, is allocated to civil society organizations. Civil society organizations are absolutely key and extremely important in order to respond to the epidemic in Africa as in other regions. So there is about 50% that is allocated to civil society, and other key partners are of course the multilaterals, the UN agencies, and some research institutions. You won't see governments here, because governments, they are funded from country level. So in Zambia we work with the government, the Ministry of Health in Zambia, but that doesn't come from the regional account. And here you see the number of countries where our regional partners have partners in their turn. So a clear focus is on Southern Africa, where the epidemic is the worst, and Eastern Africa as well. But there are actually activities carried out in most of the African countries. Okay, I took the possibility to listen in to some of our partners, what they say about community care, looking at what they do. And in that discussion, I also heard clearly from them that we cannot talk only about HIV. HIV today in 2015 must be put in the context of integration with other health issues, primary health care, and also talking about dialogue in the context, of course, of the SDGs. So community care must actually refer to community health, and particularly in relation to sexual and reproductive health and rights. Another thing to put on the table is the concepts of health system strengthening and community system strengthening. And those two cannot be seen as two different concepts. They are actually one and should be seen as one. We should strengthen comprehensive and resilient systems for health in general. Because that way we include all aspects of the health systems: private, public, civil society, institutions, service providers, systems for commodity supply, etc., etc. And then finally the word care, which used to mean palliative care, house visits, etc. But as we have seen here in the presentations before, of course we are talking about health at community level, health care at the community level, which is much, much broader than that. And we're always including aspects of prevention in that. We cannot talk only about care in the old traditional way. Another key term is responsibility. And here I think we have heard a lot about the important work that is done at the community level by lay councillors, etc. But it is the governments that are responsible for the health of their people. That's according to Alma-Ata, and it's really the governments that are responsible. Communities are needed and they carry out most of the health services, they implement most of the services, but governments are to be held account. So that's very key. I think here I want to end just quickly, and we have heard this over and over again. Looking forward, focus needs to be on adolescents. Adolescents living with HIV, their sexual and reproductive health is very difficult in many places. They don't know how to handle their sexuality, and parents have a problem. They don't know how to discuss sexuality with their children either. So that's absolutely key. Another one to tackle the epidemic is to really keep girls in schools, in safe schools. And then focus also on sexuality education for everyone. Gender-based violence is a means to prevent HIV. Another one is to prevent early marriages, of course. Testing, we have discussed that, need to be simplified. Self-testing is an excellent way. And overall, gender equality. Work with men and with boys also, because they are as equally important as girls and women, of course, and they are gatekeepers when it comes to reaching the women. So with that, I stop.
Thank you. Thank you. I was just curious, since we have a treatment action campaign here, are you at all funding treatment action campaign from Sida? No. Okay. No.
I think no, I'm not with the mic.
Yeah.
We don't have bilateral development cooperation with South Africa any longer.
So it's due to South Africa being a middle-income country?
Yes, one of those countries.
Okay. Thanks for the explanation.